Okay, so I'm here to welcome you, members of the Glick and DeHaas communities in the class of 2017, to the transition ceremony, and welcome to family, friends, faculty, and other supporters of the students. The first speaker for the program to welcome you is our new Vice Dean for Academic Affairs, Dr. Jim Record.
So let me be the second person to welcome you to the ceremony. I just want to say welcome to the family and friends. This is really an extraordinary time in the life of a medical student. And I think, students, you'll back me up when I say, you've thought about all the hard work that you've done over these last many years, and you feel completely confident now going out into your clerkships. No worries, you know it, and you're going to show it, right? So family, what you hear there too is that acknowledgement that they really understand what's at stake, right? The idea that this is now no longer about simply being within four walls of a classroom, worried about your education. Now your perspective is different. You now start on the most exciting year of your professional life, and the one really upon which you're going to base the rest of that professional life. Now your classroom is humanity. And with all its complexities and contradictions, you will be there to help sort that out. And what you know is that if you're working with patients, you better be a little anxious, because it tells us, the rest of us, that you know what's at stake. Because we all feel that way. And quite honestly, when you don't feel that way, we know it is time for you to retire. So thankfully, you can hear by the responses earlier that you understand that important charge. But it really is an extraordinary year. And one of the things you got to remember too is that oftentimes in this year, the most important answer you'll give will be, I don't know. But I'm going to find out. Because this is built around an entire system with so many points in this system to take care of the patients. It is a privilege to be part of that team, but you've got to remember too is that you're going to find in the course of this year that you're going to have some members of that team who are going to provide you with information that's going to make the difference in the life of a patient. So I would ask you to consider that as you go forward, to keep in mind that occasionally there are going to be nurses, therapists, even transporters with information that is going to make a difference. And if you really want to make sure that you are that consummate physician, you got to keep your eyes and your ears open to all the points in the system that the patients connect with, so that you can understand better. But in doing so, I think it tells you that as much anxiety as you might have going forward and as much excitement, it is a wonderful thing because you are now part of that caretaking team. And some of the most satisfying times, in your life can come from this. So I would just say congratulations for all the work that you've done and for the excitement of this next year, which will be amazing, and for which you will have many stories that you will be telling for the rest of your life. So good luck, and again, congratulations.
Okay, so now we're going to hear a few words from our college mentors, starting with Dr. Glick.
Since Dr. DeHaas is not here, I stole some of his time. So I just want to read to you from a chapter from the book I've been writing this past year, which you guys have heard about, and I'm writing it with one of the students who you're going to hear from too. And the title of this book, and you guys don't know about this, is called Diary of a Wimpy Medical Student. There's reflections from students on their first year of medical school and from their mentor, me, a neurosurgeon. So last year I decided to take a year off from neurosurgery to pursue my research, take some classes, and finish a book I've been working on for the past 5 years. This is not that book. Instead, I took a part-time mentoring job at my former medical school, which I thought this would be a nice little Wednesday afternoon teaching thing. This little job has become the centerpiece of part of my passionate life work, encompassing mentoring, teaching, neurosurgery, psychotherapy, mindfulness work, and has reconnected me with my long-forgotten memories of why I wanted to be a doctor, why I wanted to be a neurosurgeon, and it comes down to help people. So the story begins with a phone call and a letter asking me if I wanted to be a paid community mentor and for medical students at my former medical school. Well, since I had been mentoring medical students for over 30 years, I thought, great, somebody wanted to pay me for these efforts. So, of course, I said yes. Now, a community mentor for the families and everybody, all the guests, is a little bit different. This is an effort to make doctors more humanistic. Someone thought we should make medical school more humanistic. And so by taking the usual class of 200 and divided it into communities or groups of 50, and a community mentor is hired to be a kind of leader, facilitator, and advisor to this group. And I was hired as one of these community mentors. And each community mentor follows his or her house of students for 4 years, from the first day of medical school to their graduation day. I signed on for 4 years, for better or for worse. There's actually a unique formal curriculum associated with this program called Clinical Reflections, developed by the Associate Dean of Students, Dr. Reifler, an incredibly kind and visionary leader. Basically, the mentor meets with their entire group of 50 students every other week during the first year, and the students all know this, at which time we discuss assigned topics, such as ethics, healthcare, facing death, and cultural biases. Now, the students write reflections on these issues and on personal experiences. I was amazed at how beautifully written some of these reflections were, how emotional and powerful they were, and how moving and insightful they were. And yet I was the only person reading these incredibly pure thoughts and feelings of such young, idealistic, unscathed first-year medical students. And although we do share these writings among ourselves in the group, I want to share them with others. I wanted to share them with prospective medical students wanting to know what the first year of medical school was like, to the parents of the students who wanted to know what their students were thinking about in and outside the classroom, to pre-med college students contemplating a career in medicine, and to anyone who might be visiting a doctor and wanting to understand who is that person beyond his or her book knowledge, as my father used to say. I wanted to share these wonderful writings with everyone. So this is the book I ended up writing this year. And just to read you a one-page excerpt from this book based on our experience, which is pertinent for today, it's called White Coat Ceremony. And I want to take you back a little bit. So the first week of medical school, I was somewhat taken aback when I was asked to coat the new students, meaning put a new white coat, symbolic of medicine, on each of the students in my community, all 50 of them, at a huge ceremony in front of all the students, faculty, their parents, and friends. I was taken aback because I had never seen one of these or been to one of these ceremonies. They didn't have this ceremony in my day, and I considered it a kind of fluff. Now, I know this response sounds cynical, but let me explain. I mean, I love the movie Karate Kid. Anybody? Okay, Karate Kid, okay. And that is what medicine was like to me. If you want to be a doctor or a great karate master, you have to do the work. You have to carry the pail, wash the car, wash on, wash off, paint the fence, learn the ropes, sit at the master's feet and listen. And then after many years of hard work, you earn your degree of medicine and become a physician. But today, this means when the white coat ceremony day, we were supposed to put a new white coat on each and every naive kid this first week of medical school in front of the world, and now they were going to be called doctor. Yet I was expected to do this warm and fuzzy thing, so I sat up front on the stage with the other mentors and the dean and awaited my turn. After each student was coated, they were asked to step up to the microphone. Do you guys remember this? And in one word, say what it was that they thought they were bringing to the field of medicine, a medical haiku. Again, this all seemed rather light to me. But as I put on that fresh, still creased from the package, bright white, clean white coat on each of my students, I could see them transform from that wishful kid awaiting that acceptance letter saying yes and to an adult about to embark on the career of their dreams, about to take responsibility for their lives and the lives of others right in front of my eyes. And as they stepped up to the microphone to say the one unique thing they were bringing to medicine, I saw the great variety of life that these students brought forth. The rainbow of people from different ethnicities, genders, countries, races, experiences, and ages. As I flashed back, I saw that this picture was in sharp contrast to what my medical school class was like some 40 years ago. Previously to my year, the class of 100 at that time was entirely 99% white males. There was one woman in my class. But my class was the new world, progressive and open. There were 110 students in my class. 99 were white males. But now there were 10 women and 2 African American black people, 1 white, 1 male, 1 female. As I looked at this new medical class here today, consisting of almost 50% women and all the colors of the UN, I realized not only were they bringing those words that they spoke into the microphone of medicine, but what they were bringing, more importantly, were their multicultural, real-life experiences to the medical world of tomorrow, today. And medicine will never be the same again and will never look the same again. I realized that this ritual, this white coat ceremony, this touchy-feely thing that I cynically joked about was a true rite of passage. In many ways, I now even liked it and look forward to the next one. But more important, I look forward to how this class is about to change the world. Thank you.
So I'm glad we've won over the neurosurgeon. So now a few words from our emergency physician, who apologizes that he couldn't be here because he's on an assignment with the Navy in Korea. But he sent his photo, and he sent a few words that I'm going to read for him. This is from Dr. DeHaas. Doctors, unfortunately I will be on a short mobilization with the Navy in Korea when your ceremony occurs on July 2nd, but I'd like to share my thoughts with you nonetheless. Who would have thought if you put your nose down, put one foot in front of the other day after day, do your studying and your work, and simply endure, that time would eventually pass? This is an experience like no other, unless you count residency, which will be an experience unto itself. But that's the next chapter in your book, and let's not skip ahead. Hard to believe, but you will look back on these days one day when struggles have faded from your memory as fond days and days of your birth into your field. You'll never again have the blank slate of your person as you do now before you begin. Soon experiences, trials, and tribulations will form you into the person and practitioners that you're supposed to be. In the not-so-distant future, you yourselves will be class mentors and teachers, and will appreciate the irony of being on the other end of the podium. Myself doing so was one of the universe's great jokes on my former dean, for whom I probably caused many a sigh as to whom he let into his medical school. They are the things which will define you most, and your resilience and skill set in overcoming them will be the test of who you are. I have been proud to be in this role with you. You've breathed a fresh breath of air into my career, and for that I'm ever grateful. Working with you has been a wonderful experience. I stare out at you many a time and find my personal reflection of who I was that day on June 11th, 1995, when I left CMS for the last time as a student. A time not so long ago in my mind or heart. These struggles will soon be in your rearview mirror. Be proud of how you've grown. Look forward to new growth just ahead of you. You are not alone on this path. I will continue to be your mentor and eventual colleague and friend as the years go by. And they will. They most certainly will. Thank you for gifting me to stand amongst so much future greatness. It has been an honor to serve you. Very respectfully, Dirk DeHaas in Korea with the U.S. Navy. Okay, good. So now we have a chance to hear from a few of our students, and one of what the students will be reading are essays that we assigned a few months ago as part of the clinical reflections class that you heard Dr. Glick talk about, which was, this assignment was a reflection on the meaning of putting on a white coat. So I'd like to ask Lisa Lester to start.
Putting on my white coat is like slipping into a new skin. It's a simple garment on its own, and not even very well fitted, with its wide, boxy shape and slightly too short sleeves. My white coat is packed up like a traveler's knapsack. Quick reference, reflex hammer and pens in the front pocket, chapstick and mini Kleenex on the sides. I even keep the sleeves perennially rolled up to the elbow, which makes me feel more capable somehow, like I could spring into action at any second, delivering a baby or performing some other heroic feat. Well, with my white coat, I instantly become more than my everyday self. The significance of the coat is so strong that patients instantly change their view of you, potentially equating you with the highest standard of the profession it represents. In my white coat, I have spent hours seeing a single patient at our student clinic, and am always amazed at how long patients are willing to wait and how trusting they are of the gaggle of students assigned to their case. Our clinical knowledge was virtually non-existent, our confidence often equally low, but the patients never fail to respect us as if we were the most experienced doctors in the world. This is both a great privilege and a burden, and I must be mindful of the long way I have to go before I will truly have earned this respect. In the meantime, I'll be sure to take advantage of the opportunities that my white coat provides. During my clerkships, I will speak to patients about their most private lives, their triumphs, their mistakes, and their fears. I will witness babies being born, surgeries performed, even death. It's astounding that this plain garment opens the door to witness the full range of human suffering and happiness. I'm profoundly grateful for this white coat, and I will continue to strive to uphold all that it represents.
Joanna Curran.
So this essay is in regards to our old white coats, not the new pretty ones that we have now. Each time I put on my white coat, I feel a little less like I'm playing dress up. The white coat ceremony at the beginning of M1 year was incredibly special, but at that point, my white coat was just that, a clean, pressed white coat with empty pockets. As the year continued and I wore the white coat to ECR patient days and to the head-to-toe exam and to ICC, the pockets filled with pens and scratch paper of patient histories. We were given a name tag that I added to the left breast pocket. My white coat became more wrinkled as I started to do physical exam maneuvers on my patients while wearing it. There are some blue ink stains on the right sleeve from my shadowing experience last summer and my shadowing experience at the VA this past year, as I was furiously jotting down things I thought were important to present to my preceptor. Not all of them were very important. I now permanently keep my pen light in the left upper pocket because I found it much easier to use to get pupillary reflexes and examine patients' eyes and mouth than the light on the wall of exam rooms, because honestly, who knows how to use those? I have a pocket resource that I've annotated with old carts and Vindicate as reminders for myself while taking a comprehensive patient history. I now know how to maneuver everything so that my stethoscope, tuning forks, blood pressure cuff, and reflex hammer can all fit into the pockets of my white coat without looking too bulky. So what I'm getting at is that I've come to think of my white coat as a symbol for my learning process in medical school. I started out with a plain, empty white coat, and I now have a not so white and wrinkled coat with pockets full of tools and resources and knowledge. I felt silly wearing my white coat at the beginning of last year because I felt like I couldn't do anything special while wearing it. But throughout these first 2 years of med school, I've learned enough to make myself feel like I belong in my coat and like I'm not pretending anymore. Somewhat ironically, most of us ordered at least one new white coat for these next 2 years, which are embroidered with our names on them. These coats belong to us the minute we received them, and I will know to put a few extra pens and pieces of paper in the pockets and where my stethoscope fits best. I will take what I've learned these past 2 years with me to rotations next year, knowing full well that I have much more to learn and double the amount of white coat pockets to fill. So good luck with your new coats, everyone.
Thank you. Salvador Quines.
All right, the white coat, the coat that comes in at least 2 lengths, short and long. The coat that represents the medical arts and sciences. The coat you see people in labs wear. The coat that is ceremonially given to nurses, optometrists, pharmacists, doctors, veterinarians, physicians' assistants, dentists, chiropractors, podiatrists, physical therapists, occupational therapists, and clinical psychologists, and more. Coat that is sometimes not white, but a shade of blue or gray. Now, the coat that, much like stem cells differentiate, symbolizes academic and professional differentiation. The coat that symbolizes initiation into a field that specializes in serving humanity. To me, represents a mantle, a calling that gives you the privilege of addressing the multimodal problems of humanity. The wearing of the white coat goes hand in hand with the environment in which the white coat is worn. If a white coat is worn in a hospital setting, regardless of the occupation, a stranger visiting the hospital automatically assumes the person is a physician. If a white coat is worn in a grocery store or department store, the customer will immediately assume the person is a pharmacist or perhaps the butcher. Such an associative distinction allows the patient to reach out for medical attention, and hopefully the wearer can compassionately function as a gateway to optimal care. However, as much as a white coat symbolizes medical benevolence, it should only be a symbol of what is already in the heart of the person wearing it, an acknowledgement of the institution to the student that overtly proclaims, we have peered into your mind and your heart and now define with this coat what we believe you to be. Therefore, let those of us given a white coat use it as a reminder of what we must strive to maintain, minds and hearts geared toward the service of humanity.
Thank you. Nassim Ravenbach.
My story begins and ends with a white coat and a small, trouble-causing organ somewhere along the way. My appendix threatened to burst 2 days before February combined exams. Ironically, I was studying the gastrointestinal system that unit, including the small paragraph about the minor structure and essentially useless function of the organ I could no longer call my own. I was surprised by the coincidence of the situation, being a medical student during my first emergency hospital experience, undergoing a procedure I was learning about that very day, and essentially being on the other end of a white coat while I was simultaneously training to wear my own. Medical school, until that point, had well acquainted me with the challenges of pursuing this career path, but the actual experience on the other side helped me understand why. Hours after my surgery, at 5 o'clock in the morning, I circled the acute care ward attached to my IV pole. I thought about all the other rooms I was passing, all the people who were recovering from life-threatening illnesses and surgeries involving organs that actually served a function, unlike my trouble-causing appendix. The one thing we all shared on that winter night was the fact that we were all dependent on the care of another human being, on the training, education, empathy, and compassion of the white coat. My story is much less about my appendix and so much more about the understanding I gained that night as I made my 5 a.m. rounds, that it's really important to get over the fact that it's hard and stressful to become the doctor and really remember how hard and stressful it was to be a patient. It's easy to lose sight of why we're here and what your white coat will someday mean to another life. Perhaps it was the expectation and pressure of doing well all the time, but my sight often felt buried under those endless hours at the library, underneath a stream of examinations and board preparations, but somehow uncovered by this coincidence of an experience. Because by wearing a white coat, you're reflecting a well-trained mind, a promise of relief, and a commitment to being there for somebody on a bad day, and not just on an intellectual basis, not just by understanding the nature of their disease, but by really truly caring about somebody's well-being and understanding that nobody actually wants to be on the other end of your white coat. Nobody wants their lives to be interrupted, and nobody wants to be dependent on the care of another person. I will remember the physicians that took care of me that night, and not just because they so quickly diagnosed and operated on me, but also because they took the time to FaceTime my panicking parents who live states away, who even insisted on quizzing me on my first aid book the next morning to help ease my nerves over my exams the next day. The white coats that showed me, in every way, that I wasn't just a number on a list to them. I was an actual person, all freaked out of a burden I was on that Wednesday evening. So my story ends, as promised, with a white coat and my trouble-causing appendix tucked safely away in the past. I realize how untrained and lightly worn my own coat hangs from the dresser, but I also understand that my patient's struggle will always be important than my own. And in the meantime, I will remain patient for all the ways in which my coat will adjust and grow throughout the rest of my career, with a clear vision of what I hope it will bring to my patient's life: a well-trained mind, a promise of relief, and a commitment to being there on their worst day. Thank you.
All right. Thank you all for wonderful essays. So now comes the part where we actually have you ceremonially help each other on with your coat. Wait just a minute, I'll give you the instructions for that. In addition, this year, for the first and only time, we're going to have you guys put a pin reflecting your house and your learning community on your coat too. It's only once that we need to do this because of the innovation that occurred among members of your class who so wonderfully thought of a pinning ceremony for the class following you. They had that at the end of their year as a symbol of their affiliation with their communities and their houses. And it was a wonderful ceremony, wonderful recognition, and I thank those of you in this class who thought of it and put it together. Now you guys, we need to catch up. We won't have to do it for them since they've already been pinned. But the protocol here, and we'll do this one community at a time, and I'd like to ask Dr. Glick to step over to stand next to one of your students on the end. And Monica, can you stand up and just hand her your coat? So this is the protocol. We're going to ask Dr. Glick to put the coat on Monica. There you go. And now the pin too on the lapel. This I'm modeling how you do this. That looks good. All right, good job. Now what I'd like to do is ask everybody in the Glick community to stand up and hand your coat to the student next to you, and ask. And now you can help your fellow student on with their coat. They have pins too. Then the pins are red. Oh yeah. The idea here, the symbolism of helping your classmate on with your coat is that you guys are there to help each other out, not just now, but when you're working in the clerkships and throughout your careers. And once everybody has a coat on, go ahead and help your classmate on with the pin. I'm going to help Dr. Glick on her pin. Okay, excellent. So, Glick community, have a seat. And I'm going to ask Dr. Recker to help out, serve as Dr. DeHaas today and pick the first student. And can you please stand up, Joanna? And then give him your pen. Okay, wonderful. Now the rest of the DeHaas community, please stand and hand your coat to your classmate. So if there are parents and family who don't have your camera ready, we will have a good photo op in just a second here if you want to get that ready. And if once the coats are on, put the pin on. Okay, is that everybody set? So now let's ask the Glick community to stand up as well. And let's have a round of applause for the students for making it to this point of the fair. And now I'd like to ask you guys to just turn around and face the audience, the remaining audience, your family and friends. And this is your photo op. Okay, let's turn back to the front and now pull out your programs. And actually, I need you guys to stand back up again. But with your program in hand, we're going to recite the Oath of Geneva. And I invite all members of the audience who are health professionals. This is Rosalind Franklin version of the oath, which applies to healthcare professionals beyond interprofessional healthcare professionals and not just physicians. But please stand and read with me. At the time of being admitted as a member of the healthcare profession, I solemnly pledge myself to the service of humanity. I will give to my teachers the respect and gratitude that is their due. I will practice my profession with conscience and dignity. The health of my patient will be my first consideration. I will respect the secrets that are confided in me even after the patient has died. I will maintain by all the means in my power the honor and noble traditions of my profession. My colleagues will be my sisters and brothers. I will not permit considerations of age, disease or disability, creed, ethnic origin, gender identity, nationality, political affiliation, race, sexual orientation, socioeconomic status, or any other factor to intervene between my duty and my patient. I will not lose respect for human life. I will not use my knowledge to human rights and civil liberties, even under threat. I make these promises solemnly, freely, and upon my honor. Okay, thank you. You guys can have a seat. So I'm very proud of you guys for getting to this point in your education. It's no small feat to get through the first 2 years of medical school and then take a quiz at the end. So I'd like you actually to ask you guys also to take a moment to pat the student next to you on the back for me. Thank you. You're now just entering my favorite part of medical school, where you take your place on clinical teams taking care of real patients. You'll be challenged intellectually on a steep learning curve, but it will be naturally compelling to learn by contributing to clinical care. You'll actually remember things without trying so hard to memorize them because you're using them. The clerkships will also call on your abilities to engage meaningfully with people, and you guys will rise to the occasion. We're all transitioning this year, you to the third year, and I to Philadelphia. I'm sad to be graduating a little late from Chicago Medical School, and sorry that I won't be here to be with you while you absorb the new experiences into your professional roles. I'll think about you often during your clinical adventures, and I hope you will make the most of them in part by sharing your stories with one another, both in ordinary life and in the clinical reflections classes and other events on campus. Remember that your learning communities are your homeroom for medical school, where you will always be welcomed among trusted friends. It's been an enormous honor to serve as your dean. I have loved every bit of your energy, compassion, creativity, and persistence. And I thank you for all that you've done to help make Chicago Medical School the wonderful place that it is. I will now bid you a fond farewell, confident that you will thrive as you spread your professional wings. And I hope you will stay in touch. Thank you. Thank you, guys. So please join us for refreshments outside.
I hope you buy my book.
The tanners are coming in, taking pictures in front of